thyroid gland is a very important gland that's needed for life. It gives the hormone that produces energy to the entire body. Nobody can survive without a thyroid. The thyroid, when it's over-functioning, it produces hyperthyroidism, and when it's not functioning well, produces hypothyroidism. When a patient has hyperthyroidism, they have several specific symptoms. Number 1, nervousness. Number 2, hunger. Number 3, significant loss of weight. Number 4, intolerance to heat. Number 5 is diarrhea. And the patient is definitely in a difficult state in which nothing controls it unless you get thyroid medication. When the patient has hypothyroidism or low functioning of the thyroid, they have cold, they have decreased appetite, they have increase in weight, they have constipation, they have dry skin and depression, among many others. The treatment for thyroid conditions depends on both medical management as well as surgical management. Treatment for hyperthyroidism requires special medications that controls the symptoms of the thyroid condition. And symptoms that are related to hypothyroidism or low function of the thyroid requires a different type of medications. Both of them can be treated medically. However, there are conditions that medicines will not resolve the thyroid problem, and that's when surgery comes in. The 2 main conditions that require surgery are enlargement of the thyroid, that's called goiter. Some patients have a thyroid so large that sometimes they feel that they are being choked, so they can't breathe or they can't swallow. Those patients will require some form of surgery. The other condition that requires surgery is when patients find they have a nodule in the thyroid, which eventually proves to be suspicious for cancer. In these cases, after an appropriate biopsy is done with a needle, then some of those patients end up requiring either partial thyroidectomy or total thyroidectomy. If the nodule is proven to be cancer, most patients will require total thyroidectomy. You should seek medical attention anytime you think that you may have a thyroid problem. Most of the time, your primary care can diagnose a thyroid condition, and the primary care can certainly refer you to a surgeon if they find that your condition turns out to be surgical.